Hello, this is Dr. Andy Rosenfarb. Welcome to the presentation. Today we're going to be talking about medical cannabis and glaucoma. So let's get started. Upon completion of this presentation, you guys will have a better understanding about what glaucoma is. We'll look at the problems with conventional biomedical treatments for glaucoma. We'll also look for the usefulness of medical cannabis for treatment of glaucoma. We're also going to look at the limitations and concerns with medical cannabis treatment for glaucoma. Then we're going to look at some of the evidence supporting medical cannabis efficacy for treatment of glaucoma. We're also going to look into some of the cultivars or strains to consider for glaucoma patients. And then we want to finally look at the coaching role for patients seeking medical cannabis treatment. Let's look at what glaucoma is, biomedically speaking. According to the Mayo Clinic, the definition of glaucoma is that it's a group of eye conditions that damage the optic nerve, the health of which is vital for the good vision. The damage is often caused by abnormally high pressure in your eye. With over 3 million Americans living with glaucoma, it's no surprise that it's one of the most requested and recommended uses for medical cannabis. Glaucoma is one of the leading causes of blindness for people over the age of 60. For decades now, doctors have known that cannabis is effective in reducing eye pressure and providing support for those who are dealing with the condition of glaucoma. So now let's take a look at the conventional biomedical treatment for glaucoma. Typically, we use medications or surgical procedures. Pharmaceutical eye drops are available to help lower eye pressure and can be either taken orally or they can be in the form of eye drops. And eye drops, again, will help lower the eye pressure. There are also surgical procedures like trabeculectomies and iridotomies and laser procedures, again, also designed to help lower the interocular pressure to help take the stress off the optic nerve. Conventional treatment focuses on using pharmaceutical medications and surgical procedures to control eye pressure. That's really what they're going after. In terms of any interactions, right now there's no known interactions with medical cannabis and eye pressure lowering medications. However, a lot of the medications can be irritating to the eyes. We also know that sometimes using medical cannabis can cause dry eyes or red eyes or things like that. So although there's no real known interactions, if there's somebody who's using eye drops and experiencing some irritation, and then if you're using medical cannabis, that also can be produce dry eyes or red eyes. Those are just some of the symptoms that people can be experiencing. So there are some problems and limitations with conventional glaucoma treatment. First and foremost is conventional treatment is limited to just controlling eye pressure. That's all glaucoma specialists and eye doctors are really looking at. It's really important to control eye pressure, but we have to understand that there are other factors that can drive progressive vision loss and degeneration of the optic nerve associated with glaucoma. The medications also can have undesirable side effects from the eye drops, also the oral medications. And irritation, the inflammation from the eye drops can actually accelerate progressive vision loss in certain cases. Some glaucoma patients are also non-responsive or they're intolerant to the medications or the surgical procedures is not something that's an option for them. Surgery also causes scarring and inflammation and fibrosis, and the surgical procedures like the trabeculectomy process often needs to be done repeatedly. So there is a risk of acceleration of the vision loss with the risky and invasive glaucoma eye surgical procedures. Conventional treatment does not always target the overall health and function of the optic nerve. Again, we're just focusing on the optic nerve in terms of lowering the pressure. So if we lower the eye pressure, the assumption is that we're going to take pressure off the optic nerve and that's going to help preserve vision, which is true, but again, we have to explore these other factors that can contribute to the progressive acceleration of the vision loss. So isolating and managing only the eye pressure doesn't necessarily guarantee vision loss, vision preservation rather. And the reason that is because we know that there are people who are taking eye pressure medications and they also have the procedures and their eye pressure is controlled. However, they do continue to see progressive vision loss. So the usefulness of medical cannabis for glaucoma is so far the following. We know it can lower the eye pressure. We know it can help control inflammation. We know cannabis is useful for neuroprotection, and we also know that cannabis is a very powerful antioxidant. So now let's take a look at some of the evidence, the body of evidence for medical cannabis for glaucoma. We know that glaucoma is one of the earliest conditions that found use value for medical cannabis for the treatment of glaucoma in terms of its eye pressure lowering effects. So let's take a look at. So if we take a look at this first study, marijuana for glaucoma, a recipe for disaster or treatment. So this study takes more of a concerned position of cannabis use for glaucoma, and they have acknowledged that medical cannabis has shown to reduce intraocular pressure, IOP, with a limited duration though. So that means that people can smoke cannabis or vape cannabis and the effects will only last for maybe 1 to 2 hours, and they'd have to repeat by smoking again or vaping again. So it questions the sustainability. Is that something that's realistic that people can do? Are they going to be smoking all day every couple of hours just to keep the eye pressure low? Smoking throughout the day could lead towards something like cannabis use disorder or abuse or addiction or something like that. So it's really important to consider the psychological and physical effects from cannabis in terms of intoxication and how that may weigh in on the performance and activities that people have to do in terms of work, driving, focus, concentration, stuff like that. Is it going to impair their ability to function throughout the day and do that which they need to do? And finally, they are suggesting that we do need further studies. So let's look at it. The second study takes a little broader perspective into novel therapeutics and glaucoma treatment. And they start out by talking about a little bit more specifically that glaucoma is a progressive optic neuropathy characterized by retinal ganglion cell death that alters the visual field. In addition to the visual field, we can also see a narrowing, a tunnel vision. We can see spotty vision occur. We also know that people with glaucoma will tend to have problems with night vision. That's another complication that we see quite often. One thing that I really like about this study is it also considers the epigenetic mechanisms. Epigenetics are non-genetic processes and mechanisms that can cause or accelerate progressive vision loss in conditions like glaucoma. So epigenetics can be internal, like emotional stress coming from inside, psychological issues. It could also be environmental factors like UV radiation coming from the sun, blue light coming off of our screens, medications, pesticides, GMOs, food additives, environmental pollution, things like this. So the study, again, the conclusion is they're really looking at various ways and factors that can help with the neuroprotection of the optic nerve, which is a real big step in the right direction. In my opinion, in my experience, conventional biomedicine has done such a great job at focusing on the eye pressure to help preserve the optic nerve, but the deficiency has really been at neglecting things like inflammation and neuroprotection. So if we move on to the next study, the third study talks about marijuana in the treatment of glaucoma CTA, which is pretty interesting. This study suggests that marijuana is a mixture of dried flowering leaves from the tops of plants. It basically gives an explanation of what the usage in actual flower that we're using for cannabis. And again, acknowledging that it can lower intraocular pressure, specifically in patients with primary open-angle glaucoma. Now, there are a lot of forms of glaucoma. Not all forms will have high eye pressure. There are primary open-angle glaucoma is the most common condition that we'll see clinically, but there is also closed-angle glaucoma. There is gestational glaucoma that sometimes happens with pregnancy. There is also normal tension glaucoma, which happens where there's progressive vision loss and there's deterioration of the optic nerve, but it's not necessarily associated with elevations in eye pressure. Ultimately, the study is just saying that they found that medical cannabis can be a useful tool or medicine for people who are dealing with glaucoma in terms of their management of this condition. So let's take a look at our fourth study. The fourth study looks at cannabinoids specifically for the treatment of glaucoma. So this study also not only looks at the current status of cannabis treatment, we're also looking at the greater availability of marijuana in basically the United States. A big distinction that they're looking at in this study is how in the 70s, when they first started doing research and there was no genetic modification of cannabis, that the THC potency was about 2 to 3%. So basically the high that people were feeling was much more milder. Now with the genetic engineering and the increase of THC, because basically that's what people wanted, starting in the 70s, they wanted to have that intoxicating effect, really changed the nature and the potency of cannabis. So that's something that we need to look at in terms of the intoxicating effects of cannabis, and do we really need that level of high THC to have a therapeutic effect. So what I also like about this study is that they're really looking at the cardiovascular effects and the neuroprotective effects observed, but more importantly is they're basically saying that, hey, even with this high dosage of cannabis that we have today, like the 20% THC, the benefits were just as good when the dosage was at 2 to 3%, which is very promising because that means that we can figure out how to dose people with cannabis where they don't have to use these strains or these cultivars that have such high content of THC that they can take a lower dose and perhaps still see benefit in terms of the reduction of eye pressure, also the neuroprotection, and also the increase of blood flow to the optic nerve, which is quite significant as well. So let's move forward to So like the first study, this study was done by the American Glaucoma Society, and it's a position statement on medical cannabis or marijuana in the treatment of glaucoma. Pretty much they were taking the same position again as the first study, and they acknowledged that medical cannabis does have a eye pressure lowering effect, but with the intoxicating effects and the psychological effects from the THC that could really impair people's ability to produce, to work, to operate machinery, and to just function is a major concern. What I liked about this study is they discussed that the CB receptor sites were actually found in the eye, in the retina. So that is really, really promising because we know that there are endocannabinoid receptors throughout the body, but we really weren't sure if they were in the eyes. And now that we know that they're in the retina, in the macula, in the optic nerve, we know that because the receptor sites are there, that there is a clear potential to have some therapeutic benefit from the use of cannabinoids. The study goes on to discuss that the evidence from that suggests that there are properties in the cannabinoid components that really can be neuroprotective for the eye, which again is another area that we need to look at because, again, most of the conventional treatment is exclusively focused on eye pressure and not really on neuroprotection, inflammation, antioxidant activity. So that's some really great data that we see from these studies in terms of looking at hard evidence, and I'm really excited to see the more studies that come out. And again, we know that it's going to lower eye pressure, but in terms of what would be available in terms of neuroprotection, not only lowering eye pressure, but looking at anti-inflammatory processes, looking at increasing blood flow to the optic nerve, antioxidant protection. These are all areas of research that are going to be very, very beneficial in terms of helping glaucoma patients not only prevent glaucoma, but also manage their condition where the progression of vision loss can be slowed and or arrested. So now that we know medical cannabis can be useful for people who are dealing with glaucoma, either early stage, mid stage, or advanced, how do we help them? How do we help patients navigate and understand how to implement medical cannabis treatment into their current treatment if they're already having that, whether it's either surgical or biomedical in terms of pharmaceutical application of oral medication or eye pressure lowering eye drops. So as integrative healthcare providers, the first thing we really want to do to help support patients is making sure that they're getting a proper assessment and diagnosis. That means if there's anybody that's suspect or somebody is experiencing vision loss or has a family history of glaucoma and they haven't had screenings, at least my recommendation is at least once a year. If it's in the family history, then at least, I usually recommend twice a year, which is usually what most ophthalmologists will recommend. So we want to look for this because the thing with glaucoma is you don't know you're getting glaucoma. There are no warning signs. So we don't feel most of the time when our eye pressure increases. It happens at such a low rate that this is nothing that we're aware of, which is why it's so important to have routine screenings of your eye pressure to make sure that our eye pressure isn't increasing without us knowing, and that we have this low grade progressive vision loss situation going on that we're not able to perceive. Or maybe our eye pressure is just starting to creep up and we haven't really lost any vision yet, but it's starting to get to an area of risk. So if we do have patients that are at risk or experiencing vision loss symptoms and we're not sure what it is, we want to make sure that they have seen an eye doctor, either a glaucoma specialist, a retinal specialist, ophthalmologist, some type of detailed diagnostic of what's going on, an assessment of their current situation. So once we have that clarity and understanding that they have a diagnosis, we have the records that are supporting that there is in fact a diagnosis of glaucoma or glaucoma suspect, which means that some patients will be kind of early stage, like pre-glaucoma, means that again their eye pressure might be a little bit borderline high, and a normal eye pressure is basically around 11 to 13, even up into the mid-teens. Concerns start into the high teens and then certainly into 20s or higher. Glaucoma specialists or an ophthalmologist will start considering use of eye drops to start lowering eye pressure. Ultimately, if the eye drops don't work or the pressure is too high, the glaucoma specialist will recommend those procedures we talked about earlier to help reduce the eye pressure. So again, we want to review all this with our patients, our glaucoma patients, to understand where are they at, what have their diagnosis been, are they taking any medications, supplements, just get a lay of the land in terms of where they are at now before they consider medical cannabis as an integrative treatment option. So once we look at what they're taking, we want to develop a plan. We want to talk about what we want to do to help them to better manage their eye condition. Again, we want to educate them that the pharmaceuticals they're on and maybe the surgeries they had, although they've lowered the eye pressure, it's not enough to help protect the optic nerve, to keep the inflammation down, to keep the oxidative stress levels controlled so we don't have accelerated aging of the optic nerve, and also to maintain healthy blood supply to the optic nerve, which can be a factor in glaucoma. So when we come up with a plan, we can implement that plan with recommendations of dosing and certain cultivars or strains, and how often, and do we want them to, to start, how do we want them to stow? What's the method administration that's going to be most useful for their specific situation? So these are things we're going to start looking into now. So one thing we want to look at is choosing medical cannabis. The strains we want to look at. We know that there are a whole bunch of different strains, also called cultivars or cannavars. These are a lot of the industry terms that are being used. So we know that both THC and CBD content in cannabis reacts with the cannabinoid receptors in the eye to reduce any pain, discomfort that can come around that accompanies glaucoma. Again, now, we talked about earlier that when the eye pressure gradually goes up slowly, there won't be any pain. However, people can have pain from the procedures, they can have pain as a result of the eye medications, and sometimes we can have acute angle closure glaucoma where the eye pressure increases really fast, and that is an emergency situation that can cause a lot of pain. Fortunately, we won't be seeing much of those in clinic because, again, those are emergency situations. But if you ever have a patient who has a sudden pain in their eyes, or if you're experiencing that, it's definitely a good idea to go get your eyes checked out, especially if there's a family history, or you're taking things like steroids. Steroid medications have been known to accelerate or cause glaucoma. So we're going to, again, look for some of these risk factors. So there are certain strains that have high THC and high CBD content, and we know those will be most effective. So we talked earlier about we don't really know how much THC is needed to lower the eye pressure. We don't want too much that's going to over intoxicate people. We also want CBD. Now, I haven't found a ton of research on this, but it's worth noting that there have been some discussions around the possibility that high CBD strains are just taking a lot of CBD by itself. It's possible that it could increase eye pressure. This is something that I'm going to be exploring myself in clinic in the next coming year. At the time that I'm doing this, we're now in November of 2019. 2020, this is something that I'm going to be exploring with my patients as I start having more of them on CBD. I actually want to see if taking CBD does increase eye pressure. In our office, we do eye pressure testing, so that'll be pretty easy for us to test. But there has been some talk about that. So right now we are recommending that anybody who starts using CBD, just plain CBD without THC, any CBD products, to make sure that you are monitoring your eye pressure. Again, we're not sure, but there have been some discussions and some suspect that CBD could possibly increase eye pressure, again, if it's just CBD without THC. So what we are looking at is, again, we want to find out, and again, this is where more research is going to come in, that we want the THC to help lower the eye pressure, but we do know that the CBD has a tremendous neuroprotective, antioxidant, and anti-inflammatory property that we want to, harness and utilize as well. So in the end, it's going to be a guessing game. Everybody's going to have to try different strains and different doses and different ways to administer. Every person is different, and everybody's going to react to the different strains and cultivars differently. So there is going to be a little bit of a trial and error involved in this process with each patient. So moving on, so we can also take a look at different strains now. Cannabis.net is one of a few resources that lists specific strains for glaucoma that are most widely used and seem to show the best benefit. Maui Wowie seems to be hand down the most widely used for glaucoma. Cherry Cola, the blueberry cultivar, Headbound. I hadn't heard of Headbound, but Purple Kush is another one that seems to be widely used. The Purple Kush and OG Kush, I think, would also be quite useful in this. They're really popular strains. I believe they come from Afghanistan, where they're harvested and cultivated, and that's where their native origin is from. But those I've done the most research, and I would say the Purple Kush, the OG Kush, and the Maui Wowie seem to be the most widely used for glaucoma. So this is something to consider when considering which strain you want to use to treat your glaucoma situation and manage your eye pressure, again, your inflammation, the oxidative stress, and the neuroprotective capacity. So if we move on, we can look at dosage and administration route of consideration with glaucoma. So we're not really sure what the best way to administer medical cannabis is. Of course, the most common and widely used way to take medical cannabis is smoking and vaping. Smoking is still the most common way to ingest and use medical cannabis. There's also sublingual. Now, here's the thing. Before I move on, again, we talked earlier about the limitations of smoking and vaping in terms of its fast acting. So yes, it'll lower the pressure down. It gets into the body really fast, but it will have a kind of a slower shelf life, meaning that it'll be processed and eliminated by the body faster. So the eye pressure lowering effects and anti-inflammatory and the other effects will be shorter lived than if we use something, say, like a sublingual or an edible, or maybe a transdermal, like a cream. These are different areas that we're looking at in terms of their applications. Also, nasal sprays are something we're looking at. So eye drops. So they've been doing THC eye drops over the last, I think, decade or so, and that is a really interesting thing. The problem is it can be pretty irritating. So what they're doing is instead of using the full spectrum, they've isolated the THC as an isolate, and they're adding it to a solution, an aqueous solution, to put drops in the eye. And again, it's a matter of finding what dosage will get the eye pressure down without having the intoxicating effects and still, again, getting the therapeutic result that we're looking for. Again, one of the other uses for medical cannabis is, say somebody comes in, they're in their eye doctor's office and there is, acute angle closure or something where the eye pressure just suddenly jacks up. If somebody is not tolerant or not open to surgery, or they're not available to get surgery, or medications aren't available, there is an option for using cannabis to rapidly drop the eye pressure in an emergency situation, especially places in third world countries that there may not be an accessibility or an availability to medical procedures like trabeculectomies or iridotomies, and maybe there's no availability to certain medications, but for sure medical cannabis is a lot easier and inexpensive to get around to some of these parts of the world, especially third world countries. So moving on, when we look at the adverse effects of medical cannabis for glaucoma, there's two things we want to look at. We want to look at the role on the eye in terms of the effect of medical cannabis for the eye itself, and then we want to take a broader perspective and look at the body. So when we look at the eye and its effect on the eyes, we see that there can be things like conjunctival hyperemia. What's that? It's a fancy way of saying red eyes. All right, that's why we know people use Visine a lot when they smoke cannabis. Also decreased lacrimation, decreased tear production. Now our tears are very important. Why? Because they keep our eyes moist and they clean our eyes, right? They wash. Every time we blink and we have tear production, it keeps the dust and the dirt that is floating around the air that can, cause irritation or cause infection to our eyes. So it's really important for a cleaning mechanism for our eye. We know that with habitual use of medical cannabis, we can develop chronic dry eye. If we're using too much cannabis, we can have photophobia. That's light sensitivity. That comes about from dehydration and inflammation. We know anytime there's photophobia, there's always an inflammatory situation going on. And again, that could be due to the dryness or just from the inflammation that can happen if you're using too much cannabis and not hydrating properly. And we also know that cannabis use can also decrease key electrolytes like magnesium, like potassium. So again, to relieve this dryness or this drying effect on the body, we want to make sure that we're well hydrated, that we're taking electrolytes that help keep the fluids in our bodies. We also know that because of the muscle relaxation, we can have things like ptosis, where our eyes will start to droop a little bit. We can have blepharospasm. Again, that's an eye twitch that's a result of the decrease of magnesium, potassium in the eye. Again, we can get muscle twitches anywhere, but a blepharospasm is one that happens in the eye. Nystagmus is something that is normally associated with field sobriety tests. So again, when we're indicated, our tracking of our eyes, our eye movement is not going to be smooth. And then ultimately impairment of accommodation. Accommodation is when our eyes cross. If you're looking at something and you kind of bring it to center. And again, it's because of the relaxation effect of cannabis on the brain that our motor function coordination is not going to be quite there. Systemic effects of cannabis on the body include tachycardia, or increased heart rate is often something that people experience. A drop in blood pressure. So this can be an issue for people who already have low blood pressure or have hypoglycemia. So people with low blood pressure and low hypoglycemia or tendencies towards fainting really have to consider if this is going to be a viable treatment option. Also, elderly people or those taking antihypertensive medications for high blood pressure. What happens is people who are taking blood pressure medications are going to obviously have their blood pressure controlled. Then when they take cannabis on top of it, which is going to continue to lower blood pressure, or it can, we can have dizzy, kind of wobbly feelings around that. We also know that cannabis can cause orthostatic hypotension, which means when I'm sitting, if I stand up, my blood pressure is supposed to increase. But when my blood pressure is too low, my blood pressure isn't going to increase when I stand up. It's going to drop, and that's going to make me feel faint or woozy. Again, that's called orthostatic hypertension. In naturopathic and functional medicine, that's often associated with adrenal fatigue and hypoglycemia. So those are other issues that we need to look out for. Euphoria and dysphoria, or are sensations and experience that people have when they use cannabis. Euphoria is like this real high feeling, and dysphoria is kind of like a discomfort, a psychological discomfort or a body discomfort that people feel. Again, some people can have really positive reactions to smoking cannabis, and other people can have a negative. They really don't like the way it makes them feel or think. So that's, again, something to consider. Difficulty with concentration, problem solving, memory, focus, concentration. We know that we can have a decrease in testosterone. So in young men, also men who are aging, who are kind of 60s, 70s, 80s or older, where the testosterone declines, or if you're on testosterone hormone replacement therapy, these are things to consider. And finally, we know that chronic use or habitual use of cannabis can, in some cases, reduce your immune activity or your immune function. So there are certain population considerations when we're looking at medical cannabis for glaucoma patients. So sometimes breastfeeding women can have glaucoma and they can want to control their glaucoma, and the cannabis can make it through to the fetus, of course. And there have been some concerns with fetal development and brain development when there's cannabis in the body, in terms of that developmental issue. So especially with the fetal brain development and possibly delayed development in early children. So something to consider. Also, infants, young children, adolescents. I've seen a few cases where children have been asthmatics on steroid medication or on steroids for other conditions that caused a secondarily induced glaucoma state. So we know that if we are considering administering medical cannabis to children with glaucoma for glaucoma or whatever condition, then that can result in impaired brain development. There can be, cannabis use disorders. Also, scholastic performance and memory, concentration and cognition can also be affected, especially with school-age children. Definitely something to consider. When we talk about adults, we're looking more at the side effects in terms of, drug cannabis interactions, increased tolerance, and also cannabis use disorder. We want to make sure that people are, kind of dealing with their emotions and their stress, and not kind of getting to this point where they're just using more and more and more and just creating use disorder issues. With our elderly population, we know that it's very common for people to be put on blood pressure lowering medications due to cardiovascular risks like stroke and heart attack. So if we're already on medications that are going to lower our blood pressure, cannabis can make you feel dizzy. It can make you feel woozy. It can drop your blood pressure. So that increases risk for falling or injury. And we absolutely do not want to have our senior population or elderly experiencing any injuries. We want to keep them safe and out of harm's way. And when we consider our harm reduction strategy for treatment of glaucoma, we start with this: the start low, go slow, and stay low titration strategy. Now, why do we do this? Because we want to figure out what the lowest therapeutic dosage is that people can stay on that'll get them the desired outcome, for quite a few reasons. A, economically, taking more is going to cost more. Also, taking more will also give more intoxicating effects, which may not be so great for a lot of people. We also want to make sure that the body is not going to create a resistance or a tolerance. So cannabis is a drug like any other drug. The more we take, our body builds up a resistance, so we may over time need more to get that desired therapeutic outcome. It's also noted that we do not, although it is the most widely used way to use cannabis, we don't recommend smoking cannabis for glaucoma patients, not only because of its consequences on the respiratory system, but also we know again that it's short-lived. So again, if you're talking about a situation where somebody has an emergency situation where their eye pressure is really high, they're in a third world country or in a place where they can't get to access to surgery or pharmaceutical treatment, using medical cannabis, smoking it, getting it in the body to drop the pressure real quick, to take the pressure off the head of the optic nerve, it could be a vision saver, like seriously. But there, again, should be special caution with pregnant women, infants, young children, adolescents, and of course seniors. Again, we don't want them to start getting woozy or dizzy or have any ill effects. So the harm reduction strategy is so that people stay safe and use medical cannabis for the treatment of glaucoma appropriately. In conclusion, this is what we've come to. Medical cannabis is an effective treatment for glaucoma patients. Specifically how, specifically what dosage, which delivery methods are going to be most useful remains to be seen. I love that there's all this research going on now with the eye drops, the research with the transdermal applications. That means we're going to put like lotions into the skin, nasal, because the nose is so, the sinuses kind of go all around the eyes, they circle the eyes. So using things like nasal inhalers can provide a great benefit. Again, different oral applications. There's so many uses, even like nebulizing might be a way to do it. So with further exploration, we know there's going to be value here. And for me, again, as a eye care practitioner that specializes in ophthalmology and integrative ophthalmology, the biggest concern that I've seen is, again, the confusion that glaucoma patients have that simply being on eye pressure medications and having surgeries to lower the eye pressure is going to somehow guarantee that their vision doesn't progress or stabilizes. And that certainly is not the case. Again, because we know patients have their eye pressure stabilized with drugs and surgery, but they still continue to go blind. I also believe that a lot of these patients are on 3, 4, 5, 6 eye drops at a time, and the cumulative effect of those eye drops can have systemic issues. They can cause inflammation. They have systemic effects just as they have local effects on the eyes. So reducing the amount of eye drugs that patients need will, although not be awesome for the pharmaceutical companies who are obviously looking to, get as many meds out, but we want to keep in mind the safety of our patients, and we ultimately want to create integrative care modalities that'll maximize their outcomes and give them the most benefit with the least amount of risk. That's really what's important. And again, beyond the lowering eye pressure effects, we're looking at things like neuroprotection. We're looking at anti-inflammatory. We're looking at using cannabis to increase blood flow to the optic nerve. We're looking to medical cannabis is a very powerful antioxidant to protect the glial cells, the retinal cells, and the optic nerve, and the brain, because remember, the brain is really important in this whole process. The visual system is comprised of the eyes, which kind of are the antennas that we see that take the light energy and deliver it through the optic nerve to the visual cortex so that we can actually see, and our prefrontal cortex will make judgments and kind of organize our thoughts about what we're seeing. So we want to protect the entire visual system. And we do really love, the biggest thing about cannabis is its fast-acting effects, and we talked earlier about how useful it can be, especially in third world countries where they don't have access to drugs and surgeries immediately, but things like cannabis can be, very, very easily accessible and have a very strong, fast result for people who are dealing with these types of conditions so they don't lose their vision. Again, when eye pressure goes really high, really fast, or it goes high, slow, and just gets to a point where we're not detecting it, vision loss can happen really rapidly and it becomes an emergency situation. So anything we could do for the slow protection of the nerve cells of the eye and the vascular systems, all the way through protecting and managing the eye pressure and reducing the need for surgeries, drugs, and eye pressure medication will absolutely benefit glaucoma patients. So I want to take a moment to just say thank you, and I appreciate you taking your time to listen to this presentation. I hope you found some interesting content, and maybe this got your thought process thinking about using medical cannabis. Maybe it's a patient you have, or maybe a friend or a family member you have, or maybe you yourself are dealing with glaucoma. And if there's anything else that I can do to help provide some more information and education, please feel free to reach out to me at your convenience. Thanks so much. Enjoy the rest of your day.